Every child deserves a healthy start. From the first trimester of pregnancy to their curious first steps, to all the precious milestones that come after. This is the story of WIC, the Women, Infants, and Children program. My name is Maggie, and I was a WIC participant during my pregnancy with twins. WIC was there for me. I remember sitting in the waiting room, filled with uncertainty about the future. A staff person spoke to me and kindly offered resources when I needed them most. WIC gave me the knowledge to feel confident in my parenting. My family was able to enjoy mealtimes and healthy snacks, and the support we were given had a positive impact on our well-being. For 50 years, WIC has been a lifeline for families like mine, providing vital resources to support their well-being and a healthy future. The first WIC office opened its doors in Pineville, Kentucky in 1974. In a time when many American families were suffering from hunger and malnutrition. In the following year, WIC was established by the United States Congress as a national program. WIC was a response to an urgent call during the social justice movements of the 1960s to address critical nutrition gaps in America's most vulnerable populations. Medical researchers and public health advocates were raising alarms about the impacts of poor nutrition on pregnant people, infants, and young children, particularly in low-income families. In 1969, innovative pilot programs, like the one by Dr. David Page at Johns Hopkins University, sought to address these concerns. Dr. Page's work showed positive improvements in the health of mothers and children by prescribing them iron-fortified infant formula. Eventually, the program grew from a state pilot program to a federal program, using the idea to prescribe food, like medicine, to help undernourished mothers and children. By 1974, WIC expanded to a network of clinics across multiple states, including the establishment of the California WIC program. Those early years established the core services WIC offers today, where families were issued benefits for staple foods like cereal, milk, cheese, and infant formula. WIC also provided families with nutrition education and routine health checks. From its early days to the present day, WIC has also helped families access other health services, with many WIC offices located at community-based health clinics. WIC staff became advocates for families, helping them overcome barriers to care, and providing referrals to a range of essential services, including healthcare, childcare, substance abuse prevention and treatment programs, and other community resources, with many accessing these services for the first time. In the late 1980s and early 90s, breastfeeding support became a core part of WIC's service delivery. Today, WIC offers breastfeeding education, one-on-one support, and more WIC foods for breastfeeding parents. 50 years after the start of the first clinic, the WIC program serves millions of families across the country. Eligible families include households with low to moderate income, people who are pregnant, or just experienced a pregnancy, and children up to age 5. In California alone, WIC provides nutrition services in 13 languages to meet the needs of the state's diverse people and communities. As the need for WIC increased in California, so did the need for a modernized and more efficient service delivery. WIC continues to evolve in the digital age. Gone are the days of paper vouchers or checks that families first received in 1974. Today, families use the WIC card while shopping, which simplifies access to nutritious foods. The WIC card has offered an easier and faster shopping experience in the store. Families now have the flexibility to buy foods in the amounts they need when they need them. On the California WIC app, families can quickly find a WIC-approved store, see their appointments, and check the WIC foods available to them. WIC foods have expanded too, More than just cheese, milk, and formula, WIC now includes a broader range of nutritious food choices like fresh fruits and vegetables, yogurt, tortillas, beans, and more, catering to the diverse preferences and needs of WIC families. In our fast-paced world, WIC has adapted to the needs of busy families. Video and telephone appointments are now a reality, breaking down barriers and making it easier to connect to WIC and its dedicated staff, no matter where they are. What truly sets WIC apart is its staff. Many of our registered dietitians, health educators, and breastfeeding professionals come from the very communities they serve. Some grew up benefiting from WIC services themselves and have come full circle, now dedicating their lives to guiding and supporting new generations in those same WIC offices. Every day, WIC staff go above and beyond in serving almost 1 million Californians across this great state, connecting parents and caregivers with one-on-one counseling, to assist them in addressing infant and child feeding challenges such as breastfeeding and chest feeding, bringing families together through events and group sessions, creating a space for shared experiences and mutual support. WIC continues to support a movement towards equity, that every parent and child, regardless of background, deserves a healthy start in life. WIC is there every step of the way, so no parent or caregiver walks their journey alone. Together, we can build a healthier future, one family at a time.